Keeping up with the theme of breaking mental health stigma, let's talk about mental health myths that are very common in our society and demystify them. We are going to be doing a myth and the truth. Myth and the truth. These myths ordinarily are misconceptions that make it nearly impossible for mental health professionals such as myself to offer mental health services to people who need them. And as I was talking about in the previous episodes, the stigma that comes with mental health myths and misconceptions makes it impossible for people who need mental health care to seek support. And that's why we need to demystify these myths. We need to be honest, find the truth, and clarify what exactly these myths are and what the truth is. So I'm going to give you 6 very common ones, and you can go and read about more. The myths and the misconceptions are easily available on the internet, so you can check those out. So let's talk about myth number 1. The biggest myth when it comes to mental health is that mental health is the same as mental illness. The truth is that mental health is your general state of well-being. So you know how we say physical health? It's your general well-being physically. So mental health is your well-being psychologically. And just like physical health, mental health exists on a continuum. Some people are healthy and others are ill. And others are somewhere in between, somewhere in the middle. Your mental health can fluctuate based on very many factors, some of which are completely beyond your control, others are within your control. So for example, serious physical illness or genetic makeup are not things that you can control. Those are things that are completely out of your control and they can affect your mental health. But then things like your stress management, your lifestyle choices, your physical activity, the way you deal with anger and your emotions, those are things that are within your control. And those things can also affect your mental health. These factors can contribute to how your mental health fluctuates from healthy to ill or somewhere in the middle. So that is mental health. It's not one stagnant thing. It changes with time, with age, with experiences, with circumstances. It ebbs and flows. It ebbs and flows. That's your mental health. Mental illness, on the other hand, is a condition that is diagnosed by a qualified mental health care professional, for example, a psychologist or a psychiatrist. Mental illnesses are like depression, anxiety, schizophrenia, bipolar, borderline personality disorder, post-traumatic stress disorder. All these are mental illnesses. And these are things that are diagnosed by a healthcare professional, a qualified mental health care professional. As you can see, there's a difference between mental health and mental illness. Mental illness is a diagnosed condition. Mental health is psychological well-being. When it comes to like mental illnesses, feeling sad is not depression. And I think I've spoken about this before. Just because you're feeling sad, it does not mean that you have a depression diagnosis. Just because you're feeling worried, it does not mean you have an anxiety diagnosis. These things can be diagnosed only by a mental health professional, a qualified mental health professional. That is myth number 1, and I hope that is clear. If you are curious about what the difference is between feeling sad and having depression, a clinical diagnosis of depression, please listen to the episode that I spoke about the difference between those two things. It's called Feeling Depressed versus Being Depressed. I will link it somewhere in the description, so check that out. Everybody has mental health, but not everybody has mental illness. That is the main way to think about it. So every time you hear somebody perpetuate the myth that mental health is the same as mental illness, remind them that everybody has mental health, but not everyone has a mental illness. Myth number 2. It is obvious when someone has a mental illness. The truth is, there is nothing obvious about mental illnesses because different people have different manifestations of mental illnesses. They look different in different people. There are some common symptoms that can show up in people when they have a similar diagnosis, but I encourage you not to make any assumptions about someone's mental health or someone's mental state. Let them be the ones to tell you. For example, when 2 people are diagnosed with depression, you will see differences in the way that depression looks like in each one of them. Some people have suicidal thoughts, but others don't have suicidal thoughts, and they both have a diagnosis for depression. So if you expect all people with depression diagnosis to have suicidal thoughts, then you meet somebody who does not have suicidal thoughts, and they are not acting the way you expect them to act when they have a depression diagnosis, you're likely to start minimizing their suffering, and this contributes further to their pain and their isolation, and in general, this contributes to mental health stigma. I hope you can see how these things are all connected. Stay open-minded. Let people tell you about their unique experiences with mental illnesses. Don't assume that just because there's a common story that exists about mental health, it looks the same for everybody. Yeah? So it's not obvious when people have mental illnesses. Let them be the one to tell you about their mental health experience. Let them be the one to tell you about their diagnosis. Don't just assume. Myth number 3. People with mental illnesses are violent. The truth is, having a mental illness does not automatically make you violent. Sometimes people with mental illnesses are the ones who are actually victims of violence. They're the ones who are beaten up. They're the ones who are sexually abused. They're the ones who are insulted. They're the ones who are denied services. They're the ones who are shunned. They're the ones who are treated badly. They're the ones who are excluded. In some instances, a person with a mental illness can be violent, but this is not always the case. And this does not apply to everyone. Remember that thing I just said before, that mental illness does not look the same in every single person. Different mental illnesses present differently in different people for different reasons. So not all people who have mental illnesses are violent. Try to think about the people that you know who have told you that they have a mental health challenge, or the people you've had have mental health challenges. If you were to look at them critically, you would realize that not all of them are violent. And actually, a majority of them are not violent. If we perpetuate this myth that people who have mental illnesses are violent, then we make it easy for these people to be abused. We make it easy for them to continue being treated badly, to be excluded, to be discriminated against, which perpetuates mental health stigma, which means they will not seek help when they need help because they know that people will treat them differently and they will be violent towards them. So again, let's kill the myth. Let's end mental health stigma so that people can seek help when they need it. Myth number 4. Only specific groups of people struggle with mental illnesses. The truth is, mental illness does not discriminate. I think I mentioned this in one of the episodes when I was talking about the stigma. Mental illnesses do not discriminate. Anyone can struggle with mental illnesses. Poor people, rich people, educated people, parents, priests, presidents, children, sober people, people who are abusing drugs, etc., etc. The presence of risk factors such as abuse, childhood trauma, substance abuse, and poverty can increase the likelihood of you as an individual struggling with mental illness. But then we can't talk about the risk factors without talking about the protective factors. Protective factors that can protect you from suffering with mental illnesses. Protective factors include social, strong connections. You have people around you, people who love and care for you, physical exercise, healthy lifestyle, good quality of life, good health, etc., etc. This can reduce the likelihood of having a mental illness. But that does not mean that you are automatically cushioned from struggling with mental health. Anybody, the rich, the poor, anybody can struggle with mental health. Anybody can have a mental illness. None of us is special enough not to struggle with a mental illness. It could be you, it could be your friend, it could be your relative, it could be your brother, it could be your sister, it could be your colleague, it could be anyone. So don't perpetuate the myth that only specific groups struggle with mental illnesses. Myth number 5. Mental illness can only be treated with medication. The truth is, there are various ways of treating mental illnesses, including medication. People can go to psychiatrists and get prescriptions for mental illnesses. You can also have talk therapy, which is psychotherapy, what we do, counselors, what you do without offering medication. There's group therapy, there's lifestyle adjustments, there's social support, there's alternative medicine. There are very many ways to handle mental illnesses, to deal with mental illnesses, to treat mental illnesses, not just medication. Some people don't even take medication for their mental illnesses. Some people use other means, and those means are readily available. If you speak to a mental health professional, they can help you understand your particular mental illness, and they can help you weigh the options regarding the kind of treatment that you need. So don't feel that once you're given a diagnosis, you automatically go for meds. As an individual, you need to read a lot and research about the specific mental illnesses that you're curious about. Remember that mental illnesses are not a death sentence. They are not total disability. Your life is not over just because you've been diagnosed with a mental illness. Many people live and thrive as they manage their conditions, and so can you. So do not believe that the moment you've been given a diagnosis, that is the end of your life. Do not believe that the moment your loved one has been given a diagnosis, that is it, they will suffer forever. That is not true. They will thrive, they can live and exist and continue their daily life even when they have a mental illness. Mental illnesses are treatable, they are manageable, we can live life fully even with mental illnesses. So don't perpetuate the myth that the only medication is the solution. There are other solutions as well. Last but definitely not least myth. Myth number 6. Mental health care is expensive. The truth is, healthcare in general is expensive for some people, and especially healthcare that is offered in private organizations. For example, if you go to Aga Khan, the amount of money you're going to spend at Aga Khan is not the same amount of money you will spend at Kenyatta. for the same treatment. Many factors contribute to the expenses that come with healthcare in general, including the length of time, the amount of money it takes to train the healthcare workers, the amount of money it takes to run the hospital or the facility that you are going to seek your mental health services. All these things play a part. If you go to a therapist who is in private practice, the amount of money that they will charge you is very different from a therapist who is practicing at Mathari because their expenses look different. Therapists in general, and I'm going to speak for therapists in private practice such as myself, we spend a lot of money to become and continue to work as therapists. We have to pay for school just like everybody else, but on top of that, every year we need to pay for our licenses, we need to pay for continuing education, we need to pay for offices if we have a private office, you need to pay for the bills of running the office. If private practice is your only gig, you have other expenses that come with managing a business. And I've spoken about all these things somewhere on my YouTube channel. You can check it out. All these expenses that come with running a business, a private practice business, are going to affect the final amount of money I charge my clients. So you need to understand the factors that are connected to mental health care in general, and then understand how that affects the amount of money you're going to pay wherever you get the service. If you go to a doctor at Mathari, they're not paying a rent for an office. The office is provided by the hospital. If you go to a private facility, it's more expensive. If you go to somebody who has been practicing for a long time, it's going to be a little bit more expensive. If you go to somebody who is more educated, it's going to be more expensive. If you go to a therapist who has a PhD and 10 years of experience, you're not going to be charged the same amount of money as if you go to a therapist who just graduated, they have 0 years of experience, and they have a diploma in psychology, But therapy is not always expensive. I know this may sound contradictory, but it's not always expensive. When it comes to mental health, there are very many low-cost, government-funded, community-based options that you can access and get started with your mental health journey. And also, you can save up for mental health support in the future. So, ordinarily, I usually share this everywhere, and I'll share it in the description box. There are very many free options that exist right now in our country, Kenya. There are many places, many hospitals you can go and get free mental health services. There are psychotherapy clinics, there are substance abuse clinics, there are psychiatric clinics. They are all happening in hospitals across our country, and the link is in the description. You can check out. There are free helplines that you can call. There are psychologists who are offering pro bono services. You can contact all these people. So even as you think about how expensive mental health care might be, and healthcare in general might be, always remember that there are very many low-cost options that you can access to start with. And then, of course, on top of all that, you can engage with mental health professionals on the internet, those who are qualified. You can listen to the things that they talk about, the education that they offer. You can check out some of the resources that they share. I share a lot of resources on my social media. If you follow, you're going to see a lot of resources, including this podcast. It's a free resource. So it's not always that mental health care is expensive. And when it is, there are a lot of other factors in the background that contribute to those expenses. These are just some of the myths that exist out there. I could go on and quote all of them, but I don't think we have time for that right now. What I want you to do is to think about these ones that I have mentioned and listen to how many times they come up in conversations around you. When people talk about mental health, how many times do they mention these myths? And do you correct them? Start thinking about the language that you use when you're talking about mental health. This is something that I have previously spoken about. Be among the people that is championing for the end of mental health stigma. And the number one way you can contribute to that is by challenging the conversations that we have and challenging the language that we use to describe mental health and mental illnesses in general. So thank you for listening. I hope this has been useful to you. If you have any question, if you have any concern, if you have any feedback, if you have any comments, please leave them in the comment section of wherever you're listening to this. I am always happy to share mental health information with you. Check the description box for every single thing that I have to offer that is available to you, and engage with all that information. Don't just save it on your phone or your computer. Engage with that information. Start using it in your daily life. There are so many resources, and I am sharing all of them with you. Thank you for your patience with me. Thank you for listening, and I hope that I will see you in the next episode as we talk about another topic on mental health. And yeah, take care of yourself and take care of your mental health.